Hi everybody, and welcome to our module on DNA viruses. I've written the names of all the DNA viruses on the screen here, and I've divided them by whether they are naked or enveloped. There are 4 families of naked DNA viruses. Those are the parvoviruses, adenovirus, papillomavirus, and polyomavirus. And there are 3 enveloped DNA virus families, the hepadnaviruses, which is hepatitis B, the herpes viruses, and finally the pox viruses. And I write them the way I have on this screen on purpose because it helps me keep them in order. So the parvoviruses are the smallest DNA viruses, and they are the only ones that are single-stranded, so I just think of them as being so small that they only have one strand. The pox viruses are the biggest DNA viruses, and they are the only ones that replicate in the cytoplasm, not the nucleus. So I think of them as being so big that they can't fit into the nucleus. And then finally, only 3 DNA virus families have circular genomes. The rest all have linear genomes. And the 3 families with circular genomes are in the middle here: hepadnavirus, papilloma, and polyoma. So by writing it this way, it helps me easily remember all their characteristics. And this is very helpful when you get a board question. If, for example, you recognize that they're talking about one of the polyoma viruses, then you can remember that those are always written in this portion of the slide, and then you'll remember that that's where all the naked viruses are. I've written some of the rules of thumb down here at the bottom. All DNA viruses have an icosahedral capsid, except for the pox virus. They all replicate in the nucleus, except for pox. All DNA viruses are double-stranded, except for the smallest one, parvovirus, which is single-stranded. And all DNA viruses are linear, except for those 3 in the middle, which I circled right here. And in this module, we're going to talk about all of the DNA viruses except for the herpes family. They are a big family, and they share a lot of common characteristics, and we have a separate module on those viruses. Let's start by talking about parvovirus, and the word parvo comes from a Latin word meaning small, so this is an easy way to remember that this is a very small virus. It is a non-enveloped or naked virus, and it is a single strand of DNA. It is the only DNA virus that is not double-stranded. The DNA strand has a negative sense or a negative polarity, and the reason it can replicate despite being single-stranded is that it will fold over in portions and become double-stranded in those sections. They can be recognized by DNA polymerase and used to synthesize RNA molecules. The predominant parvovirus in humans is B19. There are a bunch of other parvoviruses that cause infections in dogs and other animals. And parvovirus B19 causes 4 important clinical syndromes. The first one is aplastic crisis in patients with sickle cell. The second one is a dangerous fetal infection called hydrops fetalis. There is something called Fifth's disease in children. And finally, arthritis in adults can be caused by parvovirus B19. To understand how B19 causes aplastic crisis, you have to appreciate that it replicates in red blood cell progenitor cells of the bone marrow. It only replicates in these cells during the S phase, and as you know, there's no S phase in mature RBCs. That's why it infects the progenitor cells in the bone marrow. It causes S phase arrest, and it's believed that there are molecules present during the S phase that are favorable to the virus. Once it infects the bone marrow cells, it lowers the rate of erythropoiesis. In healthy patients, red blood cell production will come back to normal in a week or 2. They may get a mild anemia, but sometimes they don't even get any anemia at all. However, in sickle cell patients, there's a high rate of RBC turnover, and when these patients lose erythropoiesis, they get a very severe anemia that is highly symptomatic. They will have pallor and weakness and lethargy, and this is why this infection is very dangerous in patients with sickle cell anemia. So how are you going to recognize a B19 infection in a sickle cell patient or in a question stem? After all, many sickle cell patients are anemic, so how do you know if it's from this virus? Well, what you want to do is watch for a sickle cell patient with a low reticulocyte count. A normal retic count is about 1% or so, and it should be very high in patients who are anemic. If it's low, you have to think of a B19 infection. These patients will usually be symptomatic from their anemia. They'll have fatigue and dyspnea. You treat this with lots of blood transfusions, and the infection usually resolves over several days to weeks. B19 infection in pregnancy is especially bad because the fetus is highly vulnerable to this virus, and there are a couple of reasons for this. First of all, the fetal red blood cells have a shortened half-life. Also, the fetus is trying to expand its red blood cell volume, so it needs to grow the number of red cells. And then finally, the fetus has an immature immune system, so it can't fight off the viral infection. So women who get a B19 infection in pregnancy often have miscarriage or fetal death. If you do a fetal ultrasound on a mother whose baby is infected with B19, what you will see is hydrops fetalis. This is fluid accumulation in the baby, like ascites around the liver and pleural effusions around the lungs. As I said before, you can see this on ultrasound. Now, often when we talk about hydrops fetalis, we're talking about what's called immune hydrops, and this is fluid accumulation because of Rh mismatch. This is very uncommon in the modern era. But there are many non-immune causes of hydrops fetalis, and one of them is a B19 infection in the baby. So aplastic crisis and fetal infections are the two dangerous clinical syndromes that can be caused by B19. But there are two more benign syndromes, and these include fifth disease, which is a childhood rash syndrome, and arthritis. So let's talk about fifth disease first. It's also called erythema infectiosum, but the easiest name to remember is slap cheek disease. This is a rash that occurs in children along with fever, and outbreaks are very common among school-aged kids, so this will run through a classroom at an elementary school. Initially, the kids will just look like they have a cold. They'll have fever and a runny nose, and this is because the virus is growing inside their body. A few days later, they get the characteristic rash, and this is probably an immune-related phenomena because the viral infection is usually resolving when the rash occurs. And the rash is very characteristic. The cheeks look like they have been slapped. You can look this up online and see lots of pictures of kids with bright red cheeks. Sometimes the facial rash is followed later by a rash on the trunk or limbs, but often it remains limited just to the face. You don't have to order any diagnostic tests or treatment. This will resolve on its own. And one important thing to know is that often the adults at the school will catch this, so the teacher or the principal at a school where a lot of kids have the slap cheek disease will catch this, and they don't get the rash. What they get is arthralgias and arthritis, so watch out for that. That is also caused by the same B19 virus. So along those same lines, B19 can cause an acute arthritis infection. This is usually in adults, and it's more common in women. About 3/4 of them will have some type of rash. There are lots of different rashes reported. It's usually not the slap cheek rash that you see in kids. That is what kids get with B19. It's often a symmetric arthritis, usually in the small joints, especially the hands, but sometimes in the wrists or the knees or feet. The joints can be very stiff in the morning, and this can mimic rheumatoid arthritis. So one thing you need to rule out when you think someone has rheumatoid arthritis is a B19 infection. You can diagnose it by looking for antibodies to B19, and it usually goes away in a few weeks on its own. Moving on from parvovirus, let's talk about adenovirus. So adenovirus is a non-enveloped DNA virus with an icosahedral capsid, just like most of the DNA viruses have icosahedral capsid. It's also double-stranded, just like most of the DNA viruses, and it causes several important clinical syndromes. First off, it can cause respiratory tract disease. Most commonly, this is pharyngitis or sore throat, but it can also cause pneumonia. It is the cause of pink eye, which is a viral conjunctivitis. This is a patient over here who's got pink eye, and you can see that the conjunctiva is red and inflamed. It can also cause an uncommon condition in children called hemorrhagic cystitis, which we'll talk more about in a minute. One of the unique features of adenovirus is that it's very stable and it can survive on surfaces, so this is how it gets spread around. If you touch a countertop that someone who's infected with adenovirus has touched, you can pick up the bug. It's transmitted by aerosol droplets. It's transmitted fecal-orally. This is how kids often get adenovirus infections. And as I said before, contact with contaminated surfaces is a common way to pick up adenovirus. So adenovirus can cause a syndrome called acute hemorrhagic cystitis, and this often occurs in children. And as I said before, they tend to spread this virus around, so watch for outbreaks and board questions at daycare centers or schools. The children will develop hematuria, and sometimes it's gross, so they'll note that their urine looks red or dark brown. Sometimes they also have pain with urination. Usually there's no fever or other symptoms, and it's often self-limited. The next DNA family of viruses are the papillomaviruses, and these are non-enveloped DNA viruses. They are double-stranded, and they have circular DNA for their genome. There are multiple subtypes of papillomavirus, and they're all numbered like 1, 2, 6, 11, 16, and 18. And they cause 3 different types of clinical disease depending on which subtype is causing the infection. Some subtypes cause cutaneous warts, other subtypes cause genital warts, and then finally, there are so-called high-risk subtypes which lead to cancer. So this is a picture of someone who has a wart on their fingertip here, and warts like this are caused by papillomavirus. They're caused by serotypes 1, 2, 3, 4, 7, and 10. And you can treat them a couple of different ways. You can use liquid nitrogen, which freezes the wart and it falls off. You can also use salicylic acid, which will dissolve keratinocytes that are infected, and they will sort of flake off. And then there are other surgical techniques as well that are sometimes used. This is a picture of someone who has a genital wart on his penis. Anogenital warts are called condylomata acuminata. They are sexually transmitted infections caused by papillomavirus subtype 6 and 11. They're described as soft, tan, or cauliflower-like lesions. In a board question stem, you should know that the word verrucous means wart-like, because they're often described as verrucous lesions. They can occur in the penis, like in this picture, also in the vulva, and sometimes in the perianal area. When they occur around the anus, they can lead to rectal bleeding. There are a number of different treatments. There are chemical agents, there are surgical therapy, there are some drugs that are used. And an important thing to recognize is that the subtypes of papillomavirus that cause anogenital warts do not lead to cancer. So just because someone has one of these doesn't necessarily mean they're also going to later get one of the cancers caused by HPV. So now let's talk about how human papillomavirus is linked to cancer. People can have silent, persistent infections for years that can eventually lead to cancer, and there are several malignancies that are associated with HPV infection. The one with the strongest association is cervical cancer, but anal cancer and penile cancer are also associated with HPV infection, and there are some oropharyngeal squamous cell cancers like of the mouth and throat that are also associated with HPV infection. This usually happens from infection with subtypes 16 or 18. These are called high-risk subtypes, and they're responsible for about 70% of malignancies that occur from HPV infection. And all of these malignancies are more common in HIV and AIDS. It's believed that the immunosuppressed state allows the virus to thrive and leads more readily to cancers. So let's talk about cervical cancer specifically. There's a very high presence of HPV infection among sexually active women. Now, most women will clear the infection, but some will have it persist, and these are the women who are at risk for cervical cancer from HPV. There's a vaccine available. It contains capsid proteins of the virus. Some of the vaccines target types 16 and 18, which lead to cancer, and there are vaccines that also target types 11 and 6, which are the genital wart subtypes. And the reason we do pap smears is to screen women for infection with HPV and evidence of cervical cancer. A key finding of HPV infection on a pap smear is the presence of koilocytes. These are epithelial cells infected by human papillomavirus. They have large, darkened nuclei. That's usually the easiest way to recognize them. They also sometimes have perinuclear halos. If you look at this picture on the screen, on the left side here are some normal epithelial cells with small nuclei. On the right side of the screen are koilocytes, and you can see that they have very large and dark nuclei. The next family of DNA viruses are the polyomaviruses. These are non-envelope viruses. They have double-stranded DNA, and they have a circular genome. There are two viruses that are medically important in this family, and they both cause disease in immunocompromised patients. The two viruses are called the JC virus and the BK virus, and they're named for the initials of the first patients who were found to have infection with these viruses. The JC virus causes PML, which is progressive multifocal leukoencephalopathy. This is a central nervous system disease that classically happens in patients with the HIV virus and AIDS. The BK virus is a virus that likes to go to the kidneys. You can remember the K for kidneys. So it's a classic disease in people post-kidney transplant who are immunosuppressed. They will get a BK virus infection and they will have a slowly progressive rise in creatinine. Both of these viruses are relatively common, and lots of people have antibodies to them. Sometimes when people become immunosuppressed, either from AIDS or from medication, they can have a latent infection reactivate and cause disease, as well as from primary exposure. So back to our overview slide, I've now talked about the four families of DNA viruses that have no envelope, the so-called naked viruses. And so for the rest of this module, I'll talk about the DNA viruses that are enveloped. There are three families in this group: the hepadnaviruses, the herpes viruses, and the pox viruses. Herpes virus has its own separate module, so I'll talk about hepatitis B and the pox viruses now. The hepadnavirus family has one medically important virus you need to know about, and that's the hepatitis B virus. This is an enveloped virus with a circular genome, and it has three unique characteristics that you need to remember for your boards. Unique characteristic number one is that it has partially double-stranded DNA for its genome. Some of the DNA is single-stranded. When hepatitis B gets into liver cells, it goes to the nucleus. In the nucleus, the DNA becomes fully double-stranded, and then mRNA is synthesized, which heads to the cytoplasm. The second unique feature is that in the cytoplasm, that mRNA is used to synthesize reverse transcriptase. You may think of this as an HIV enzyme, but it's also important for hepatitis B. Once reverse transcriptase is synthesized, it will use the viral mRNA as a template to make viral DNA, and that viral DNA will be packaged into capsids, which can then make up new virions. And then finally, the third unique feature of hepatitis B is that it gets its envelope from the endoplasmic reticulum. Most viruses get their envelope from the cell membrane, but hepatitis B is different. It's the only one you really need to know about that gets its envelope from the endoplasmic reticulum. So this is a picture to reinforce in your mind the very unique way by which hepatitis B replicates. Its genome is partially double-stranded DNA, which is converted to double-stranded DNA in the nucleus. That double-stranded DNA is converted into mRNA, which then is used to synthesize proteins in the cytoplasm. One of those proteins is reverse transcriptase, and it will use the mRNA as a template to make new viral genomes of partially double-stranded DNA. And I talk about the symptoms and clinical features of hepatitis B in the module on viral hepatitis. The last family of DNA viruses that we'll discuss are the pox viruses. These are envelope viruses with a double-stranded linear DNA genome. They have a very unusual and unique capsid type. It is not icosahedral or helical. It has a complex shape that's described as either an oval or a brick shape. This is a picture of an electron micrograph of a pox virus up here in the top right of the screen to help remind you that it's got this unusual shape. It's a very large virus, one of the largest viruses. It replicates in the cytoplasm, not the nucleus, and this is unique among DNA viruses. And as I told you before, you can just think of it as being too big to fit in the nucleus, and that's a way to remember that it's both large and that it replicates in the cytoplasm. It brings with it its own DNA-dependent RNA polymerase, so normally viruses can find this enzyme in the nucleus, but because pox likes to replicate in the cytoplasm, it has to bring its own. So it's going to make RNA in the cytoplasm and then synthesize proteins for replication. There are two relevant human diseases caused by pox virus. The first one is smallpox, and the second one is molluscum contagiosum. Smallpox is caused by a member of the pox virus family called the variola virus. Initially, patients who get a smallpox infection have nonspecific signs of inflammation like fevers, headache, and malaise. And then a characteristic skin rash erupts which goes through phases. There will be macules that evolve into papules and then become raised pustules. And this is a picture of a child in Bangladesh who has smallpox, and you can see it's a very disfiguring disease. Smallpox was eradicated by vaccination in the 1970s, but there's concern that it could be used as a weapon of bioterrorism. The virus is maintained in US and Russian labs, and people worry that if some bad guys got their hands on it, they could release it into a city or a crowded area, and this could cause a new outbreak of smallpox. There's a member of the pox virus family called the cowpox virus, which causes obviously a disease called cowpox. This is a disease of cows where they develop pustules, and this is a very important disease historically because it's from this disease that the concept of vaccination was created. So milkmaids often got small blisters on their hands from taking care of cows who had cowpox. So a man named Edward Jenner noticed that milkmaids almost never got smallpox. So he did a very bold and daring thing, and he inoculated a boy with cowpox in 1796. Then he exposed that boy to smallpox, very dangerous thing to do, and the boy did not get an infection. And so it was from this little experiment on this little boy that the idea of vaccination was created. And in fact, the word vaccine comes from a Latin word which means cows. There's another member of the pox virus family called the vaccinia virus, and this is what's used to immunize people against smallpox. It causes a mild skin reaction and is used as a vaccine so people won't develop smallpox. And then the last member of the pox virus family we'll discuss is called the molluscum contagiosum virus. This virus obviously causes the condition molluscum contagiosum. This is a skin infection that's common in children. The virus is spread by direct contact. It's often spread by scratching, so children will scratch one of these lesions and then touch another area of their body. This is called autoinfection. The lesions are full of virus, so when you touch them, you can spread it to other people or other areas. They're described as flesh-colored domes, and this is a buzzword for the USMLE, and you can see in this picture that they look like flesh-colored domes. There's a central dimple, and then it's raised on the outside. Sometimes they're itchy. Usually this is a self-limited infection, and it resolves over a few weeks to months. And that concludes our module on DNA viruses.